So in order to grow hair back, you first have to figure out why you're losing hair in the first place. Is it because you have female pattern or male pattern hair loss, which can happen due to hormone fluctuations over time? Is it because you have an autoimmune disease like lupus or alopecia areata? Is it stress related? Or did you just undergo a major emotional or physical change in your body, which causes telogen effluvium, which a lot of women experience after childbirth? Do you have some other medical condition like thyroid disease or anemia or vitamin D deficiency? So the first thing you should do if you're losing a lot of hair or if you're losing more hair than normal is go see a dermatologist and get worked up to figure out what the underlying cause of the hair loss is. Once you know what's causing the underlying hair loss, then you can turn your attention to focusing on treatments. Of course, the treatment depends on the cause, but in general, I do like to recommend using topical Rogaine or Minoxidil for hair loss. That has been proven to help thicken up hairs and also grow new hairs. It's a topical solution. You divide your hair in 5 parts and put 5 drops in each part, and it's something that you would have to do ongoing as long as the hair loss is occurring. Another option is to take an oral supplement. A lot of these contain different blend of vitamins and herbals. Some of them contain saw palmetto, which has some anti-androgenic effects. The ones I like to recommend are Viviscal, Nutrafol, or Untangled supplements, which can be found at Foundation Skincare. I don't have any conflicts of interest with any of these companies. You don't want to be using any tight hairstyles that could be pulling or tugging on the hair. You just want to wear that loose, let your hair down, give your hair a lot of TLC. Depending on the cause of the hair loss, there could be certain procedures that you might be a good candidate for. For example, if you have autoimmune alopecia areata, we often will inject Kenalog shots into the scalp to help combat your immune system from attacking your hair. For certain types of male pattern or female pattern hair loss, we could do platelet-rich plasma injections with or without microneedling. For female pattern hair loss, we often recommend spironolactone, which actually is the same medication that we use to treat female hormonal acne. But all of this depends on the underlying cause of your hair loss. Once you figure out what's causing the hair loss, then you can work with your dermatologist to tailor your treatment plan to specifically treat those problems.